Have you ever noticed subtle yet concerning changes in a loved one and wondered what they mean? Many people believe that death in old age happens suddenly, but the truth is that the body often sends quiet warnings months or even a year before life reaches its final stage. The problem is that these signs are often missed because they seem small at first. It's only later, looking back, that families realize the clues were there all along, but by then, it's too late to prepare or make those last memories count. In this video, we will discuss 5 key signs that often appear a year before an elderly person passes away. Some of these might be things you've noticed but brushed off as just aging, while others might be minor changes that actually signal the body's gradual decline. Recognizing these signs early gives you the opportunity to provide better care, cherish meaningful moments, and most importantly, ensure that your loved one's final stage of life is filled with comfort, dignity, and peace. Stay with us until the end because these 5 signs can help you prepare emotionally and practically for what's ahead. And the last point is the most important for you to fully understand. When someone you love is nearing the end of their life, one of the most profound and challenging changes you'll notice is a deep, persistent fatigue that no amount of rest can cure. This isn't just feeling a little tired after a long day. It's a profound exhaustion that makes even the simplest tasks, like getting out of bed or walking across a room, feel overwhelming. Activities that were once routine, such as cooking, dressing, or holding a conversation, become too draining to manage. This isn't a sign of laziness or a need to push through it, but rather a sign that the body is conserving its remaining energy as organ function begins to slow down. This extreme weakness is a direct result of the body's metabolic slowdown. The heart doesn't pump as efficiently, circulation weakens, and muscles don't get the same level of oxygen they once did. Instead of fueling movement, the body shifts its energy toward preservation. This is why your loved one might start sleeping more, needing longer naps during the day, and finding it difficult to stay awake for extended periods. They may even experience sudden drops in energy, where they seem fine one moment and completely drained the next. The emotional impact of this fatigue can be heartbreaking. Many seniors who once took pride in their independence begin to feel frustrated or embarrassed that they can't do what they used to. This can lead to them withdrawing from conversations, avoiding social interactions, and stopping hobbies they once loved, which only accelerates their decline. For family members, it's painful to see a loved one go from active and engaged to exhausted and withdrawn. The most important thing you can do is understand their limits and allow them to rest without expectations. Instead of trying to force activity, focus on making the remaining days as comfortable as possible. The goal is not to see how much they can do, but to ensure they feel loved, understood, and at ease. Continuing with the second key sign, one of the earliest and most telling indicators that a person may be approaching the final year of their life is significant unintentional weight loss. You might first notice subtle changes, like a belt that needs to be tightened or clothes that seem to fit more loosely. While many families might dismiss this as a normal part of aging, losing weight without trying is rarely a good sign and often indicates that the body is no longer absorbing nutrients efficiently. This loss of weight is often tied to muscle mass decreasing, which can make movement more difficult and increase the risk of falls. A key reason for this is a physiological change in appetite. The sense of taste can fade. Food may no longer seem enjoyable, and the body, sensing it's beginning to shut down, no longer signals the brain to seek food as often. This isn't just a matter of preference. It leads to less energy, less strength, and a gradual decline in overall health. It's also important to remember that weight loss can be a common symptom of underlying medical conditions, such as cancer, heart failure, or kidney disease. Even conditions like depression or cognitive decline can lead to a reduced appetite, creating a downward spiral where the body isn't receiving enough fuel. If you notice that your loved one is continuing to lose weight despite efforts to encourage them to eat, it's a sign that the issue isn't just diet, it's the body preparing for a deeper transition. At this stage, forcing large meals may not help. Instead, focusing on easy-to-eat foods and ensuring proper hydration can make a bigger difference in maintaining their quality of life. Moving on to our third sign, a noticeable change in breathing patterns and circulation is one of the most telling physical signs that the body is preparing for its final stage of life. You might observe that your loved one's breathing becomes slower, more shallow, or even irregular. At times, they may pause between breaths, or their breathing might speed up and then slow down unexpectedly. Some people may even experience a rhythmic breathing pattern known as Chine-Stokes respiration, which alternates between deep, rapid breaths and long pauses. In conjunction with these changes, you may notice signs of weakened circulation. The body begins to prioritize blood flow to vital organs, reducing circulation to the extremities. This can cause their hands, feet, or even their nose and ears to feel cold to the touch. The skin may also appear pale, bluish, or mottled, particularly around the fingers and toes. Your loved one might also experience shortness of breath, even with minimal movement, such as simply sitting up or shifting positions. You might notice them breathing through their mouth more often, or having to stop and catch their breath while talking. Sometimes, fluid can build up in the lungs, making breathing more difficult. This can cause a persistent cough, gurgling sounds, or a feeling of tightness in the chest. While this might be mistaken for congestion from a cold, it's often a sign that the lungs are weakening. For family members, seeing these changes can be frightening. It's natural to want to help by encouraging them to take deeper breaths, but in many cases, this is simply the body's natural way of slowing down. The focus shifts from trying to reverse these changes to providing comfort. Simple measures like keeping the room cool, using a humidifier, or offering small sips of water can help ease their discomfort. As a person approaches the final stage of life, one of the most striking changes you may observe is an increase in cognitive confusion or withdrawal. Someone who was once sharp and engaged might begin to forget things more often, struggle to follow conversations, or seem disoriented in familiar places. This isn't just everyday forgetfulness, it's often a result of decreased circulation and oxygen supply to the brain, which impacts cognitive function. They may repeat themselves, forget names, or lose track of time, even if they never had memory issues before. In some cases, they might have brief moments of lucidity, followed by sudden episodes of confusion, as if their mind is fading in and out. In addition to cognitive changes, you might notice a significant emotional withdrawal. A person nearing the end of life often loses interest in social interactions. They may speak less, engage less, or spend long periods sitting in silence. This isn't because they no longer care about their loved ones, but because their brain processes emotions and engagement differently. Conversations can become tiring, loud environments feel overwhelming, and many seniors eventually retreat into their own world. You may also notice changes in their mood and behavior. Some might become more irritable or anxious, while others may seem unusually calm or detached from things that once mattered to them. For families, this stage can be especially difficult, as it may feel like you are losing your loved one before they are actually gone. However, it is crucial to remember that this is not something they can control. Instead of trying to force them back into conversations, the best approach is to meet them where they are. Speak gently, offer reassurance, and understand that even if they don't respond, they can still feel your presence. This is a time to be patient, cherish quiet moments, and focus on creating a safe and peaceful environment. Even when words fade, love and comfort can still be deeply felt. Our final and perhaps most crucial sign is the presence of frequent infections and slow healing. As the body begins to wind down, one of the clearest physical signs is a weakened immune system. You might notice that a loved one who rarely got sick before now seems to catch every cold or flu, and what used to be minor illnesses now take much longer to recover from. Simple wounds, like a small cut or bruise, also heal at a noticeably slower rate. These changes aren't random. They're signs that the body is no longer able to defend or repair itself the way it once did. Repeated infections like pneumonia, urinary tract infections, or UTIs, and even skin infections become more common. The person's body loses its ability to fight back, and even antibiotics that once worked quickly may seem less effective, requiring stronger medications or longer recovery periods. Another overlooked issue is chronic wounds. If small scratches or bruises aren't healing properly, it could mean that circulation is compromised. Poor blood flow means oxygen and nutrients aren't reaching the skin and tissues efficiently, making healing much slower than usual. What's even more concerning is that infections in the final year of life often don't look the way we expect. Instead of a high fever, a senior may simply seem more tired than usual, more confused, or less interested in eating. A sudden decline in mental alertness is often the first warning sign of an infection in elderly individuals. For families, it can be frustrating and heartbreaking to watch a loved one go through repeated infections. It's tempting to push for aggressive treatments, but at a certain point, the focus shifts from curing to comforting. Understanding these signs now allows you to prepare for the road ahead with clarity, compassion, and the ability to make every remaining moment meaningful. As we come to the end of this video, it's important to reflect on what we've discussed. Significant weight loss, extreme fatigue, cognitive decline, frequent infections, and major changes in breathing and circulation are all key signs that often appear in the year leading up to an elderly person's passing. These changes may not all happen at once, and they may not always be obvious at first, but when you begin to notice them, it's a sign that the body is preparing for its final transition. For many families, these changes can be difficult to accept. It's natural to want to fight against them, encouraging a loved one to eat more or push through their exhaustion. However, the best thing we can sometimes do is listen to what their body is telling us. Understanding these signs isn't about fearing death. It's about being prepared for it. It's about being able to offer better care, make important decisions ahead of time, and ensure that your loved one's final months are filled with love and dignity. This is a time for cherishing moments, sharing stories, and letting them know they are valued and not alone. With that said, thanks for watching, and until next time,